Okay, I think it's time to get started. I want to welcome everyone to the American Indian and Alaska Native Prevention webinar series. I'm your host, Kate Trams, and today we have Dr. Vanessa Simonds presenting on designing community-centered designing community-centered prevention efforts in partnership with Native communities. One second, I gotta
Your
make
microphone
sure.
has been turned on.
Sorry about that. I think everyone who's joining us by phone maybe couldn't hear, but hopefully you can hear us now. So I want to welcome you all to our webinar today. Again, I'll just repeat in case you missed it. Today we have Dr. Vanessa Simonds presenting on designing community-centered prevention efforts in partnership with Native communities. This training series is brought to you by the National American Indian and Alaska Native Prevention Technology Transfer Center. We are part of the PTTC network, which also includes 10 regional centers, a network coordinating office, and the National Hispanic and Latino PTTC. In the next couple of days, we will send out a follow-up email to everyone who attended, which will include a link to the recording, handouts of the slides, and a CEU request form. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEUs for a $15 fee. But we'd like to point out that we are currently working on additional CEU options that would be more applicable to prevention specialists, and we'll make that available as soon as possible. Immediately following today's webinar, you will be redirected to our GIPRA evaluation. This survey takes just a few minutes to complete and asks about your satisfaction with the event. This feedback is critical to our future work, and we value your opinion and would greatly appreciate your time in sharing your thoughts with us. You will be muted for the duration of this webinar, so please use the chat pod to share your questions and comments, and Dr. Simonds will address questions at appropriate points during the presentation. Our presenter today, as I mentioned, is Dr. Vanessa Simonds. Dr. Simonds uses community-based participatory research to design, develop, and implement strength-based, community-centered outreach strategies in partnership with Native American communities. Dr. Simonds has been working on CBPR projects with the Crow tribe for over 15 years, and for the past 5 years, she has led a collaboration with the Crow tribal partners to design and pilot a child as agent of change intervention with youth and their families. So I first met Dr. Simonds when she was a professor here at the university. She was here when I started here, and at the University of Iowa, I should say, and now she is at Montana State. And so, yeah, she's there to be closer to her tribe and to be able to be in her own community. And so, yeah, I just want to welcome you now, and thank you so much, Dr. Simonds, for being with us today. And we'll pull up your slides here. They should be up in just a moment.
Okay. Thank you, Kate. I'm very honored to be asked to give this webinar today. Let's see. So for the first, let's see if I can remember. Change my slides. Okay, so today's objective, I'll just give you a little introduction of who I am. And then I want to talk about two basic foundations for the work that I do. First, I've been very much informed by Indigenous methodology. I started learning about this during my graduate school when I read Decolonizing Methodologies by Linda Smith and Sean Wilson's book, Research's Ceremony. But I even saw that these concepts came up even earlier. I just found that Verna Kirkness and Ray Barnhart wrote about the 4 R's in 1991. So today I'm going to talk about 5 R's and show you and discuss how I can apply them to the work that I have been doing in Crow. The second basis of my work is a health literacy framework. So health literacy is more than just reading skills. It's about being able to access, understand, and use health information to make decisions about your health. And so I use Nutbeam's framework. He's an eminent public health leader, and his concept was based in the pedagogy of the educator Paulo Freire. So first I wanted to kind of give background and center who I am and where I come from. So my perspective is very much as a tribal member, Crow tribal member who grew up. I grew up in Bozeman, but I always went back, traveled to Crow, which is about 3 hours from Bozeman, to visit and to be with my family. I'm also an academic researcher, so that's kind of the perspective that I have. Most of the research I've conducted has been on preventative health efforts in Native communities, but also they all include a research component. My work has really been informed, as Kate said, by a community-based participatory research. And so that is, if you don't know what that is, it's really conducting research in partnerships with community members in all phases of the project. So from coming up with the question, the research question, through collecting the data, analyzing it, and disseminating the results. And CBPR is very much action-oriented, so it's not just doing research to collect information and write papers, but to actually do something with the community where you are making a difference and addressing issues. Through my work with Indigenous communities, I've also come to understand the importance of Indigenous research approaches. And I actually really have grappled with how to integrate the Western-based research methods I was learning in graduate school with Indigenous approaches that are from where I come from and that are necessary when I am working in Indigenous communities, for me at least. So I'm going to use examples from research projects that I've been a part of. Messengers for Health, which is the women on the right side of the slide, that's a project that I started working on as an undergraduate, and it was a long time ago, probably like 15 to 17 years ago, and that was really my first taste of research, of community health research, and where I really got to be back in the Crow community and learn about a research process where we're working in partnership. They've expanded from a cervical health intervention, which is what I worked on. They did an intervention with providers to kind of help providers work with community members who are advocates for other tribal members, to now where they're addressing chronic illness. And so they've been around for a long time. The picture on the left is the summer camp that I just completed in June actually. And that's a project that I started 5 years ago where we have been piloting an intervention to promote environmental health literacy in youth. So for those of you that are tribal members or have extensive experience in tribal communities, many of these things, these concepts from Indigenous research approaches will be familiar to you and maybe obvious to you. So I also welcome your input at any time or in the question and answer period. And so as I mentioned, as an Indigenous researcher trained in Western institutions to be an academic researcher, I struggled early on with how do I reconcile Indigenous approaches, what are they, what do they mean for me with my Western academic training. When I tried to analyze how to do an Indigenous research methodology and dissect it from a Western perspective, I used to get stuck and worried about how I would move forward to do any type of research. But fortunately, one elder said to me as I was talking about this struggle, he said, it's about moving forward, not being paralyzed, not discounting my Western training, but realizing I am who I am and to do the research that comes from my heart and to work to address health inequities. And so at this point in my career trajectory, I'm much more comfortable with who I am and realizing that Indigenous research approaches are fundamentally part of my research, and I can't really separate them from me or from how I do my research. But I don't define them in a strict sense. I think of Indigenous research methods as an approach to my research and a foundation to my research. If I had a simple, straightforward definition, I would use one that has evolved from how I've come to view community-based participatory research. So community-based participatory research, or CBPR, is not a set of methods or a prescription for doing research. It's more of the process of doing research, which aims to go, as I said, starting from identifying the health topic through disseminating the results and doing that in partnership with the communities. And so an Indigenous research approach really is having those Indigenous values as a foundation for all phases of the research process. So I'm going to start with I'm going to give you a little background on Crow in case you're not sure where it is or who we are. The Crow, or the Apsaalooke Nation, are located in South Central. It's the red spot in the map. And South Central or southeastern Montana. Crow country was established with the Treaty of 1851. Originally covered 38 million acres, so actually the reservation border came all the way over close to where I am right now. But the government whittled it down to a much smaller area, and today we have about 2.2 million acres. So this is part of our original homeland, however. It is the largest reservation in Montana and the 5th largest in the country. The last time I checked, there was about 13,000 people living on the reservation, with 70% of enrolled Crows living there. 40% of our population is under the age of 18. So this is a picture of the students I had during our summer camp at Pretty Eagle Point. So we like to take them out to experience significant Crow cultural sites as part of our project. So the first R I want to discuss is relevance. When designing prevention efforts in Native communities, we have to figure out and make sure that the health issue is relevant to the community and that the methods are appropriate for addressing the health topic. A CBPR approach helps ensure that the health topic is relevant because community members are involved, as I mentioned, in all phases of the project. So in the case of Messengers for Health, the topic of cancer was identified by community members. The method that was used in that intervention was a lay health advisor approach. And so this is where community women really are the intervention. They were trusted women in the community that were nominated by other community members and then were trained and educated in respectfully and culturally appropriate educational methods to talk within their social networks about cervical cancer screening. With the Guardians of Living Water project, so the other project with youth, community members had already identified water quality issues before I started working on the project. And they'd actually worked for over 15 years identifying contaminants in well water and examining their local water sources such as streams and springs, rivers. And so when I first came back to Montana as a professor when I left University of Iowa, I was invited to meet with the Crow Environmental Steering Committee, which included some of my relatives. And they had several members that were very concerned about water quality. They invited me based on my connection to the community and my background in health education and health literacy. So my hope was that I would be able to use health literacy principles to translate the information about water quality and risk to community members. I met with their team, and after a second meeting, I was on my 3-hour drive to Crow one spring, discussing with my doctoral student about the project. And we actually had a whole plan lined out to develop a program similarly based on what Messengers for Health was, that lay health advisor approach. So we were all set, and when we got to the meeting with community members, our whole idea really transformed because we started to talk about children and the importance of passing the information along. So this group of elders that were working on the Crow Water Quality Project really wanted to make sure there was going to be people that would take this issue on after they got finished doing it. And so we talked about that. We also talked about smoking interventions and how children have been used to help pass information about secondhand smoke to their parents and kind of nag their parents to quit smoking or to wear seat belts. This was an area that I wasn't as familiar with. I hadn't worked with youth before and I hadn't worked on water issues, but I was really excited as I talked to community partners. So this really illustrates the flexibility that can be helpful in maintaining fruitful relationships. After we decided to reach out to youth, we decided to expand our partnership to the Little Bighorn College, which is the tribal college, as well as the Crow Agency public school. So another R, so respect. So as the project progressed, we struggled identifying messages that children could share with parents. The challenges to mitigation of contaminated water is immense. What are the messages that we could instill in youth? How could we promote children as agents of change? One of the goals of our steering committee was also to increase leadership skills in youth. And we finally realized that there were basic messages that we could, and core values that we could focus on, which included taking care of our resources, or respecting our resources, and understanding what places our communities at risk. So these are pictures of, this is Cold Springs on the right, which is one of the springs that we visited and tested, and also heard stories about. And then that's the Little Bighorn River, a swimming hole, which we also test to make sure it's not contaminated with E. coli. So addressing health disparities in Indigenous communities requires effective, respectful solutions. American Indians, as I'm sure you all know, have experienced a legacy of colonization, and many communities may distrust research or outside programs coming in. They may tire from participation in studies that haven't really been designed for them, or are not providing solutions, or seem irrelevant. So the use of community-driven needs and resource assessment for developing interventions really is not a new concept for tribal people, and really is inherent in Indigenous ways of knowing. An important aspect of tribal sovereignty that's particularly important to research also, and also any prevention efforts, is as researchers are recognizing more and more the benefits to community engagement. And so it's not just, it's a way to alleviate the ethical ramifications of past public health efforts that have even harmed Native communities, such as forced sterilization or without informed consent, or research that stigmatized communities, like the Barrow Alcohol Study, which labeled the whole community as having an alcohol problem, which has had far-reaching consequences. And so programs that are implemented without community engagement can be hindered by the misperceptions of the purpose, the process, and the benefits, which can cause further misunderstandings and distrust in institutions. But community engagement is not just for recruiting people into programs. With community-driven partnerships, American Indian community members will have a greater understanding of the purpose of the program and ensure that communities not only recruited into the program, but that they stay engaged, leading to retention and ultimately better health outcomes. So further, appreciation of and understanding of self-governance in tribal communities has become integral to successful research in Indigenous communities. The development of research guidelines and tribal research codes can help ensure communities' best interests are at the forefront of the research agenda. In addition, successful research in American Indian communities also requires a basic understanding of the social and political dimensions impacting health outcomes. So, for example, American Indians are subjected to a great deal of stereotypes related to alcohol use, and an intervention that doesn't address stereotypes or neglects to take them into account as part of the context of the intervention could face many challenges in attaining community buy-in. In the case of Guardians of Living Water, we also have to respect the social and political context of environmental health exposures. Jurisdiction on tribal lands is complex. Figuring out who has jurisdiction, federal, tribal, or state, can be complicated. And the ambiguous nature of jurisdiction can also cause tribal people to experience even more environmental injustices. And as mentioned, the biggest challenges we faced was identifying those tangible goals that children could reasonably accomplish and that would truly mitigate their community's multifaceted water issues. So one way we ensure that our community-centered, our projects and our programs are community-centered is through the use of advisory boards or steering committees. And these are pretty standard for CBPR projects. The Messengers for Health program has a community advisory board that has women that are interested in women's health. They have elders, health educators, health professionals, cancer survivors, and health activists that are from the community. The Guardians of Living Water established a steering committee, and we included members of the original Crow Environmental Health Steering Committee as well as new partners. So we were fortunate to partner with a local principal who has provided us with so much support and so much access to resources. The director of a local nonprofit, so she works on economic development, and so she's been helping us find other grants to keep our program sustained. We have local parents. We also run our project through the Little Bighorn College, so that's where our project coordinator is located. And then when we first started out with our program, we presented to the tribal council, the Crow Cultural Committee, and there was a member of the Crow Cultural Committee who was appointed to our steering committee. Our research team consists of the local project coordinator, Christine Martin, tribal college interns, and then we have me, who's on faculty here at Montana State in Bozeman, and then the students that I work with. And so we teleconference weekly to plan sessions. The project coordinator runs sessions usually over at Crow with the interns, and some of our members go over there. I'm always traveling over there. And after each session, we come together to talk about what went well, what could be improved. We then present these reflections to our steering committee. And the steering committee kind of gives us ideas and feedback for future sessions. They also help us identify local community members to present water-related information to our students. So they really provide the direction and advice for the program in these monthly meetings. And all of our work is done in partnership when we provide the trainings, when we write papers, as we're developing education and promotional material, when we're analyzing data, and in the dissemination of information to the community. So it's important that our committee brings a variety of expertise and experiences to the table. We all have different strengths, and as partners, we grow as we learn from each other. And it's really helpful that our team has different ideas and come from different aspects of the community, and we listen to each other, provide feedback so that we can develop an intervention that really is beneficial to the community and is improving health outcomes. So this is a picture of a doll that my mom made to kind of illustrate cultural-centered interventions. Researchers with American Indian communities have outlined recommendations for conducting effective interventions in communities. So there have been several papers that have talked about what are the best ways to work with American Indian communities. And several of the factors that have been associated with successful outcomes include incorporating culture into the intervention, having community empowerment actually as one of the intervention's goals, and then involving community members in the design and the implementation of the intervention. Over the years, these recommendations have been further refined, and I think more recent calls have been increasing attention to really indigenous approaches to the program and the need to address how they may contrast with Western ways. So this is an evolution of research that not only attends to culture, so it's not just incorporating culture, but it's really being culturally centered. And it's not just involving partners, it's really community driven. So Guardians of the Living Water is centered on a community identified issue and is founded on the cultural importance of water while incorporating selected Western-based science lessons. So after our first program, we did experience a potential conflict between Western and Indigenous concepts of living water. So although we grounded our program in cultural values, and that was central to our agenda, during our pre-pilot, we realized we needed to really better integrate these ways of knowing. In our first camp, we had to discuss with the kids that how in school they're taught that water is non-living, but from a Crow perspective, we talk about water as a living entity with energy. And these are two different ways of knowing. One of our community partners explained to the children how he integrates Western science with his cultural worldview. And so we continue to make this discussion a foundation of our program. And so also consistent with previous studies, we've found that those direct experiences, such as field trips when we go out to Pretty Eagle Point or go to the springs or rivers and hear stories and test the water, those really have more of an impact on our children. Our steering committee emphasized to us the value of visiting these sites and going to our local mountains as something that children would always remember. And so we always have a component of our program where we have guest speakers talk about Crow cultural values. So this is a picture of one of our steering committee members, John Doyle, telling some stories to our youth. So another example I wanted to provide regarding the importance of culturally centering our work is a struggle that I had when I was working with Messengers for Health as a graduate student. So I was just out of my health theories course, and I had just learned about the precede-proceed model, which I'm sure many of you know about. And it's a theory used in health education to design and evaluate health interventions. So we were about to design that second phase of the project where we were going to train community people to be advocates and help other community members navigate the health system. And so we conducted interviews with healthcare providers as well as local community women. And we were using what was called the critical incident technique. And so we had healthcare providers provide a story or an example of a good incident that they'd had, a good interaction they'd had with a patient, and then we asked about a bad interaction they'd had. And then we did the same thing with community women. We asked, what's a good interaction you've had with your provider, and what's a bad interaction? And so we're really gaining both perspectives of good and bad interactions. My plan was to use the precede-proceed model to categorize the themes from the interviews. And because this was a CVPR project and we were working with community women, we were having them help us and actually do the analysis with us. And so we developed a training on qualitative analysis, and I conducted that training with my community partners. I explained how to identify codes. I passed out transcripts from the interviews. We initially did an IRB training, a human subjects training, before we did this. And then gave them the transcripts and sent them home. And we said that we would go home and we would code the interviews and come back and talk about it again. So at the next meeting, I attempted to put the codes into the categories of the model, and I was asking for their help and kind of what they had come up with. And really at the next meeting, nobody had done the coding, and it felt a little bit uncomfortable. So I provided an overview of the theory again. I did some examples, and we said, okay, we'll come back in the next meeting and we'll have them all coded. But the next meeting was even more uncomfortable. And at one point, one of the advisory board members said to me, Vanessa, we really want to help you, but this really doesn't make any sense to us. So that really stuck with me, and I didn't know where we were going to go. So we were like, so we decided to end the meeting, and we made an appointment for our next meeting, but not really talking about what we'd do in the meantime. My advisor, our community project leader, so we all discussed what had happened. And then we went to the next meeting and we had a discussion with our board about what was happening. And really what came out of those discussions was the importance of storytelling in Crow culture. And that what I was asking them to do was to break down these stories, which was very uncomfortable to them. They felt it was very disrespectful to the storyteller, what I was asking them to do. And we also talked about how these transcripts, just these words on a white page, typed words on a white page, lost much of the context, which is also really important in Crow storytelling. So it's important to know where the storyteller is coming from. And reading the transcripts lost the context of their voices, what they were saying, and how they were saying it. So this experience really disturbed me. I felt bad. But I was also happy that the women felt comfortable sharing this information with me. So we threw out the precede-proceed model. At the time, we couldn't really figure out a better way to do it. So we kind of just focused on having discussions about what was the collective story. We came up with some of our own themes, relevant themes through discussion. But really, and I came up with a model and I verified it with them. But I was still uncomfortable with where we had ended. In the next few years, we had another opportunity to develop a program. And this is the program that's now going on, the Bonnie Law program, which is a chronic illness project. And so this time we wanted to do it in a much more culturally centered, respectful manner. And so We asked community members again to talk about managing their chronic illness. So we asked people, that felt successful at it, and kind of what were the challenges to managing chronic illness. And this time we decided we would actually listen to the audio recordings of the interviews all together. So instead of getting the transcripts and passing them out, we listened to the interviewees telling their stories. And so we made sure to get permission. Some people didn't want to have their voices, didn't want us to listen to their actual voices, so we distorted them a little bit so you couldn't recognize them. So depending on how comfortable the storyteller was with identifying information, that was kind of what we provided to the board. Our project coordinator had conducted all the interviews, so before each interview, she gave an overview of the context of the interview before we listened to it. So kind of age, what was the illness the person had, kind of some background, where did the interview take place. And so we all listened to each interview, and then we had a discussion about the interview. And kind of one thing that our project coordinator said was for us to talk about what had touched our hearts in this interview. And so this was a much longer process, as you may imagine, several months, several meetings, many more meetings. But it was all much more comfortable for everyone involved. And we really just had several discussions about what was important out of these interviews and what should the subsequent chronic illness prevention program address in order to be relevant to the community. So this leads me to the next R, which is related to what I just talked about. So those relationships are what made us all feel comfortable, made women feel comfortable telling me, this wasn't making sense to them, instead of just going along with me or letting me do what I wanted to do. If you want to make large-scale change, you will likely be able to do more by working together with others. And so relationships really have been central to bringing me to where I am today. An example, so this slide here shows, in the middle is the logo for the Guardians of Living Water project. And these are the different partners in our project. So they have the Crow Environmental Health Steering Committee on the right. And then we have Montana State University, which is what I represent. We have Crow Agency Public School, which we have the principal from there and the academic dean. And then we have the academic dean from Little Bighorn College and the president there. And our project coordinators housed there. So yeah, in that first year of the project, we had new partners that were committed to this idea of working with youth. And so I had barely kind of gotten funding to get going and really wasn't ready. We hadn't decided on, what was the messages we wanted youth to have, what was the evaluation we were going to use, what were we actually going to talk to children about. But the principal got funding immediately. That first summer, really when we weren't, from a research perspective, we weren't ready. But we called that our pre-pilot. And we didn't really have data that was usable for publishing a paper, but it allowed us to test out our measures, to test out some activities. And what it was really about was building that relationship and helping us move forward. Because it was important for us, from Montana State University, to show that I had a commitment to the community beyond just doing research that benefits the researcher. So relationships are also key to recruiting community members to programs, but also for maintaining engagement. And so much of the literature also talks about how trust is integral to success of a partnership, and it has been integral to our partnership. Trust had to be built between the project partners. So in our steering committee, we built trust between me and my project coordinator. And then that's expanded throughout the community. And that's important for our project coordinator to be able to recruit and to have people, buy into our program. Our partnership with the local school and the principal has really enabled us to have this central space to recruit students and families. We have community dinners there. It's a place to hold our sessions. We also disseminate findings through community dinners. We've attended community events like the open house. And we're really lucky to have the support of the principal. and to build the relationships with him, but not only him, but with staff in the school. So the staff there are also really accommodating. They help us move tables and chairs, set up sound systems to support our project. Our project coordinator's relationship with the community was also important. And we really benefited from having that local community member who worked closely with the local school and engaged students. And so she goes to the schools to check on students and to remind them of our events. From our experience recruiting children, the children and their parents, they do require consistent reminders. And they enjoy having Christine come in and give reminders, whether it's an announcement in the classroom or running into them at a store or a basketball game. Challenges include the age range of our audience. So we have grandparents raising grandchildren, we have parents, we have younger children, and so we have to use different media outlets. So we use flyers, we use newspaper, we use social media, we actually call and text. Another issue that we've had is scheduling conflicts with other community events and transportation. It was especially difficult during the academic school year. So several children, in one of our school programs, several children missed nearly half of all the sessions. But we really did keep them engaged through in-person visits to the school. And so all but one actually completed the Photovoice project that we did in 2016 and 17. We also invite children to attend successive programs. So I started out with 4th graders in 2015, and they're now 7th graders. And a few of them have been with us this whole time. And we are able to build upon the skills and knowledge each session that they've have acquired, as well as, so we're moving beyond, which I'll talk about in a bit, but we move beyond this functional literacy to more interactive and critical literacy activities. And it's also helpful, we found, to have returning children serve as role models for children that are new to the program. And that role modeling has really been effective in our summer camps and after school, where we also have what we call mentors or facilitators who are high school or college students who are helping us with this, to run our sessions and to teach the children. So our project really does use a strength-based approach, so we're building on the role of children in communities and the relationships in families. And when you come from more of a strength-based approach, that can help build trust between the community and the research partners or outside partners. And that can result in even better health outcomes. But building these relationships really does require a trust between project partners and attention to the expectations of each partner. And so it's important to be upfront and continually attend to evolving expectations. And so community interventions really benefit from long-term partnerships. But this really does require more time for relationship building and sometimes less focus on academic products, which can be a challenge for academic researchers. But a respectful and responsible approach to research that really talks to community members and talks about these conflicts and these conflicting priorities can help things run a bit more smoothly. It's taken our project 4 years to really build recognition in the community. And we were most successful in 2017 when we saw that students were presenting water quality test results from the local area. And we found on Facebook that these presentations really prompted parents to ask to have their well water tested. And then one of the posts had over 20 posts from local community members really just discussing this issue and the need for action. So reciprocity. This is another central value of our programs and for my commitment to my work. It's always important to bring back what we learn in the community and not just go take data and go back to your office and write papers. So this means making sure community has access to the results of the program, so the program evaluation results, and that it's available in a clear, concise format. So this is important if you're doing a program, so that they have that basis, like what has happened before. So if people are starting to do other programs or want to build off programs, it's important that they know what's been done and what's worked and how well it worked. In the last year and a half, we've begun to focus on having children collaborate as co-researchers. Our summer camp culminated in a presentation of research results. So this was a way that we were giving back to community. So having the youth really do these research projects, to have questions about, how safe is our water? What are the differences in water quality across the reservation? And then presenting them to their parents. So in 2018, we had much more. I'll show you a picture in a bit, but it was a much more research poster, and I felt that it was still a little bit. I think it really prompted people to ask questions about their water quality and to learn about their water quality. But this year, we did a lot more of the a more friendly poster basis, which wasn't just the research project, but also had some stories about local sites as well as the research results. And so Reciprocity is about giving back to the community and making sure they're getting the benefits. And this is important because it's our responsibility when we're running these programs to share what we have learned. So that brings me to responsibility, which is another important part of our program. And I, as a researcher, have a responsibility to these communities, and it's especially close to my heart because my family is from there. And so it's important for me to make sure that my work is valuable to the community. But our program is founded on respect and responsibility. And we want to encourage youth to think about what are their responsibilities. As I mentioned, we had to think about what are feasible ways that children can take responsibility. What are the things they can do that can have long-term impacts on the communities? And this picture shows them at one of our local springs testing the water in the Wolf Mountains. Another issue that I have been grappling with most recently as my initial grant is ending is really considering sustainability when we're designing and implementing community-centered efforts. One of my community partners said to me that a program that just disappears after the grant funding runs out may be even less harmful maybe, than if there had been no program at all. This is hard in a climate of competitive funding, especially research funding, which is what I know about. I'm not sure about other areas. But our Guardians program was fortunate. We were fortunate to have this initial funding that was for a junior researcher, for me, and that gave us the time to build this relationship and to build this program. But environmental health interventions have a long latency period, so it's difficult to have measurable outcomes that can be attained in 5 years. Our program has developed this curriculum for summer camps and activities that we're going to provide to local schools. We've developed games and activities about local water sources and contamination, which we'll also provide to teachers in the community. And we just recently the youth actually produced movies about these issues for the community. And we do have some bridge funding, and we're continuing to look for ways to keep the project going in whatever manner we can. Messengers for Health, which I talked about, the one for the cancer prevention and chronic illness, they are a much longer partnership. And initially, they also had research grants that were run through the university, and project staff were employed by the university. As the project evolved, the Apsaalooke community members, Crow community members of the partnership, decided to develop a nonprofit organization. And so they were able to seek support from other avenues, including foundations and nonprofits, to support their work. And so I see them as a very successful partnership, how they've gone from being more kind of from the university running everything to on their own running their projects. So these are kind of those 5 areas, these values that underlie my work. And so what I've realized in my approach to Indigenous methodologies is not going to be perfect or pure, just like CBPR is never perfect, especially when I'm operating from the academy and the university. It really requires a bridging of understanding between the demands of the university and the responsibilities I have to community. Okay, so I'm going to switch gears a little bit here, make sure I get some time to talk about the health literacy framework. I want to touch on how health literacy has provided this framework for intervention development and evaluation. So health literacy is about that compatibility between skills and preferences community and the demands of Western medical culture. So when the demands of the healthcare system don't match the skills and preferences of the community, then we can have health disparities. And so in our project, we've used this to guide our framework, and it kind of helped us build a successive program over each year. So this is Nut-Beam's framework, where he has functional literacy, interactive literacy, and critical literacy. And so functional literacy is that first level, and it aims to improve the knowledge of health risks, and services, and focuses on the application of reading, writing, and speaking. And so this is important in most prevention efforts. We started out with lessons about water and its importance to human health. And we wanted to make sure that students understood the cultural importance of water from basic water properties. And what we did find is that by this final year, kids were understanding, what E. coli is, how it gets in the water, what kind of health outcomes it causes, and how it can be prevented. We found increases in the understanding of both parents and children. And these are just a couple of quotes from the child's perspective of what they were learning and the parent's perspective of how our daughter was looking at posters and actually asking questions after she had been part of the camp. Interactive literacy is that second level, which really aims to improve personal capacity to act on knowledge. And so that first year we really focused on what are the knowledge that we want kids to gain. And then the second year we realized we expanded and we went into, okay, so how are we going to improve and help them act on the knowledge they're gaining? And so we had newsletter activities that children did to take home. They did surveys with their parents. They asked their parents about well water quality and what they knew about well water quality, to tell them stories about local springs. And parents talked about how they felt that we were on the right track, and that children sharing information was appropriate, and that children are sacred to us, as this one parent pointed out in her quote. So this picture is just of our Photovoice exhibit, where we captioned our photos, and over a year and a half, we showed these around the tribal building, the wellness center, and they were at the tribal building for like 6 months in the hallway. We went to take them down. They said, "Oh no, leave them up." And this was really a way to also evaluate our program. So we used the Photovoice methodology to kind of see what children had learned through the program. We did a survey with community members, and we actually had our students help us conduct the survey. So it was they had a lot of fun recruiting community members and telling them about their Photovoice project, and then having them fill out the survey. So we really were trying to teach them research methods and have them be part of the research. And so community members talked about how the issues that were brought up by the youth were also issues that they thought were important and needed to be addressed. So the final level we expanded our program to focus on is critical literacy. And so this is that capacity to actually interact in the home and in the larger community. And I like to think about it as like taking action and working together to take social action. And so in our later years, and mostly in this last 2 years, we really worked with children as co-researchers. So they developed their own research questions and their own methods for educating community about water. And as I mentioned, they produced a couple movies this past summer. After the Photovoice, one of the ways that they wanted to take action was they always talk and think about trash. Every year we talk about that. And so we decorated trash cans and put them up around the community in places where they noticed pollution. This is just a picture of some of our facilitators and youth conducting E. coli water testing. And that's really the favorite thing that they do each year, is testing for E. coli in the water sources and comparing across the community. This is a picture of, as I mentioned, the research poster that we did last year. And this is our students presenting to their parents and the rest of our advisory board. And so really, in conclusion, I want to reiterate how we use these 5 R's and how it's helped center me and Indigenous values to make programs that we implement in line with what the community wants and how they can benefit from them. I want to highlight active engagement, and it's especially important when we're crafting health education information. Active engagement makes sure that we're including community member perspectives, their voice, community language. They can identify jargon that we may become too familiar with as health educators, so they can identify unfamiliar terms or scientific concepts or difficult math concepts or tasks. And so this formative research, pilot testing, and thinking about health literacy principles, so how can we make this information accessible to community members, really must guide the development of our health programs. And so my health literacy background really was instrumental in the development of the Guardians Project, and it helped move our intervention beyond knowledge acquisition to really promoting social action in youth. I know these children that come to our programs would do great things anyways, but perhaps in some ways our program is reinforcing these values related to respect, reciprocity, responsibility, and relationships, connecting us to our land, our water, and each other. So I just want to acknowledge some of my current project partners. Our funding for the Guardians Project is through the Center for American Indian and Rural Health Equity Grant, and then I have some references for you as well. So if anybody has any questions.
Thank you so much, Dr. Simonds. And yes, we'd love to have all your questions and comments. If you want to submit those in the chat box, please do so now. Dr. Simonds, I had one question for you. If I remember right, you said you worked with the public schools, and so it sounds like maybe you started doing some presentations there with students, but then were students volunteering to participate in the study, or were they were like classes? Did the classes work together with you, so students were doing this as a part of their schooling?
Yes. So the initial first year, we actually recruited all the fourth graders, and we sent out recruitment flyers to the teachers. And it was teachers that had actually worked with us in the summer camp. And so those people, that was just after school and whoever wanted to show up. So it was more just, we had community meetings to kind of introduce it. Our initial community meetings, there wasn't that many people that showed up, but, and then we'd have people sign up that didn't end up showing up. So recruitment has been difficult in those cases. But more recently, this past spring, I've kind of gotten all the research, like pilot test, pre and post test. So in that case, it was more, we just provided some presentations to classes. So it wasn't really a research piece, it was just providing it. And we went into the other schools that we hadn't been working with on the reservation. So Crow Agency is the main school that we had been working with. And then we went to Wyola and Pryor and worked with teachers and the principals at those schools, and just did the presentation of one of the games that we had developed to learn about the crow names and crow stories for this local spring. So I've kind of done both.
Okay, yeah, thank you. It's so great to see all the pictures of the youth involved, and it seems like, it may have taken a while, but it looks like you had really good participation, and the kids seem to really be excited about what they're doing. It's really cool to see.
Yeah.
Looks like someone else is typing. Just while we're seeing if there's any other questions, I'll just remind everyone, someone else asked about recording this, and I just wanted to mention that we are recording this. We will be putting this up on our YouTube channel, and everyone who registered will get an email with the link to the recording, so you can share this with colleagues and rewatch, and we'd love to have you do that.
So should I answer this question by Shannon?
Yeah, that'd be great. Yeah.
Okay, so we start out with fourth. So her question is, did you work with the kids to develop the curriculum, or did you do that independently? And so we started out with youth that were fourth graders, so it was that was kind of challenging. But so we did more work with the community partners, and we found we found a curriculum called Project Wet, and so that really had the science-based lessons that we had, and then we talked with our community partners about, what is the cultural side and how do we integrate these two. So we worked more in partnership with adults. Um, I did do interviews with the students to ask them, what was your favorite activities? How could we make them better? And so I did get some feedback from them, and we used that to improve our project.
Wonderful. Okay. Yeah, so we've just got a couple more minutes, so if anyone else has questions, please submit them. Otherwise, feel free to email me. I'll put my email in the chat box in just a second if you have any other questions, and we can follow up with those later. But yeah, just remind everyone too that the as well as the recording that will be emailed out to you, we also will be sending the handouts to everyone who attended and a CEU request form if you'd like to earn CEUs for attending today. And when we close out today, you should be redirected to our GIPRA evaluation. And so if you wouldn't mind just taking a few minutes to fill that out. The link to that will also be in our email in case you don't quite make it there today. It looks like I don't see any other questions for now, so we'll go ahead and finish up. But yeah, I just wanted to thank Dr. Simonds so much for sharing on these wonderful projects. It's so exciting to see the work that you're doing and yeah, the way that you've incorporated the stories and traditions there. And yeah, I just want to thank you so much for sharing this with us.
Yep, thank you, Kate, and thanks everyone for listening. And feel free to contact me as well if you have any questions. I don't know if my email's on there, but maybe you can give it to them.
Yes, yes, absolutely. So here, I'll type my email here into the um, chat box a second, and then I will put Dr. Simonds in there as well.
I did it too. I probably can do it faster since I know it.
Okay, perfect. All right. Thank you. Perfect. Wonderful. Well, thank you all again for joining us, and we'll be having another essential substance abuse skills webinar next week Wednesday. So hope you all join us for that. And thanks again to Dr. Simonds, and hope you all have a great day.
Thank you.
Mm-hmm.